Hello, everyone, and welcome to the August 20, 2020 regular meeting of the East Baton Rouge Parish School Board. First item will be notice. This notice is in reference to the East Baton Rouge Parish School Board's certification pursuant to Act 302 of the 2020 regular session regarding board member participation by telephone or video conference as it relates to the school board meetings. Please be advised that due to the public health emergency caused by the coronavirus disease 2019, COVID-19, and Act 302, the East Baton Rouge Parish School Board may, for the duration of this emergency, conduct board meetings and committee meetings electronically via telephone and/or video conference. The regular meeting scheduled for August 20, 2020 at 5 p.m. will be streamed live via Microsoft Teams events. A link to watch the meeting can be found on board docs located on the school board's website, ebrschools.org/about. A period for written comment, public comment will be provided before the meeting as well as before each action is taken by the board on an action item. Individuals wishing to make a public comment about any of the posted action items will need to click on the agenda item in board docs and submit via the highlighted public comment hyperlink on the agenda item details. Upon closing the comments, the board president will read into the record the public comments that have been submitted. So with that, I will now call the meeting to order, and we will go to the invocation by school board member Jill Dyson and the Pledge of Allegiance led by school board member Connie Bernard.
Please bow your heads. Oh, loving God, give us courage and wisdom as we face the realities which confront us in life around us and around the world today. May those with gifts for human health and hope discover ways which help us to end the threatening infections of the coronavirus and restore our lives to a new day. Give to us, we pray, a profound sense of community, respect for ourselves, respect for authority, and all of those we interact with as we care for each other and value our varied viewpoints. Hold us in your loving arms as we journey forward in opening our communities and schools safely and move into a healthy and prosperous future. Call us towards a deeper faith, believing that you are always with us. Lift our hearts as we face each moment and our challenges as we move through times of differing opinions and the reopening of our schools in East Baton Rouge Parish and across our nation. We pray this in your name. Amen.
Amen. Ms. Bernard?
Please join me in reciting the Pledge of Allegiance. I pledge allegiance to the flag and for the republic which it stands, one nation, indivisible, with liberty, justice, and for all.
Mr. Goday, you're muted.
We'll now go to the roll call. Madam Secretary?
District 7, President Goday.
Here. Here.
District 3, Vice President Howard.
Present.
District 1, Mr. Blue.
Here.
District 2, Mr. Lannis.
Present.
District 4, Ms. Collins. District 5, Ms. Ware Jackson.
Here.
District 6, Ms. Dyson.
Present.
District 8, Ms. Bernard.
Present.
District 9, Mr. Tatman.
Mr. Tatman?
I'm not sure that he's going to be on, Mr. Gode.
Mr. Gutter?
Hello?
Your internet.
My internet must be going in and out. Can you hear me now?
Yes,
Yes.
sir, we
Okay.
can hear you.
Thank you. We have a quorum. First is item C1, meeting minutes. Approval of the school board minutes of the July 16th, 2020 regular board meeting, August 6th, 2020 special board, and the August 6th, 2020 committee of the whole meeting as published in the official journal. Do I have a motion?
Bernard moves approval.
Bernard and then Howard seconded. Are there any comments from the board? Seeing none, I am double checking the internet. I have no comments on the internet. Back to the board. None, Madam Secretary.
Please vote. Mr. Blue,
Yes.
Mr. Lannis,
Yay.
Mr. Lannis, can you mark your answer?
It hasn't popped up yet.
You may need to get out of it, refresh your screen. Mr. Howard,
Yes.
Ms. Ware Jackson,
Yes.
Ms. Dyson, Ms. Dyson,
Yes.
Mr. Gode, Mr. Gode, Ms. Bernard.
Yes.
All right. So until Mr. Gode finishes, or is that all of the votes, April?
Yes, I was trying to get Mr. Lannis's vote in. The motion carries. I think we just lost Mr. Gode. That's also. Can you take over?
I think I might be back. Am I back?
You are back. If you need to go out and again, just let me know, Mr. Gode. Yes.
My internet's clicking on and off. I voted yes. Sorry about that. Next is the monthly financial report for information only. Are there any comments or questions or concerns from the board on the monthly financial report? Seeing none, we will go to personnel changes. The information has been presented from our personnel department with an update that was recently sent out from our superintendent. Are there any questions or comments related to the personnel changes report? Seeing none, we will then move to item E1, the update from the superintendent. Mrs. Brown. You're muted, Mrs. Brown.
I am now unmuted.
Yes.
Thank you. There's always a little time delay between mute and unmute, so thank you very much. So it's just great to be here with you all again, and it's a pleasure to go through the board agenda items and the meeting with you tonight. So we've had a really great start to the 2021 school year. Our current enrollment, I think that's important for everybody to hear, is 39,136. We actually have seen an increase from the first day to today, and we're very, very happy with the enrollment, and it does continue to rise. We are actually seeing at the elementary level about 93.4% of our students are actually engaged and enrolled at our schools, and at the high school level, it's about 94.2% of our students were in attendance. So we're continuing to reach out to our families, and we really have started a lot of community support initiatives to make sure that we're getting all of the devices and information out to parents as every single day we're seeing more going out. This team has been made up of a lot of different parts of our organization. I think one of the pieces that has been very important is that our Family Connect with EBR with Mr. Edwin Wilson and Mr. Andre Gordon, the parent liaisons in our virtual program. They're serving as lead facilitators for this particular new initiative, and they will be working collaboratively to support the child welfare and attendance team by actually calling families and identifying students that need support. We also have seen quite a bit of engagement in other ways across the schools as well as across the district. School level teams actually are using various attendance reports, and we're actually matching those attendance reports to the device distribution to make sure that we're seeing where there may be gaps in what we're seeing in attendance from 1 day to 5 days and anything beyond that. That becomes a list for the schools to double check and check up on all of the students at every single school. They've been doing a great job. We're also going to be starting a reporting of the students that we have not been able to find, and we will be making sure that we get out to those homes and those families as well. So the students and families have been really doing a great job of coming into the schools. If you've been able to go into any of the schools, you will see that there's little kiosks set up at the very front where they can pick up their device and their hotspot. We also want everybody to know that devices and hotspots are still going out. Any of the tech survey that we have out there where we see that there are parents that still do not have hotspots or a device, we send those lists to the schools, and we actually go and deliver the hotspots to the schools. I was there with Miss Ware Jackson earlier this week at 2 of her schools, and really started looking closely at making sure that every child and every family has that hotspot. Home visits are also taking place, so I think it's important to know that schools are going out to homes to make sure children have the hotspots, and so we're trying all different levels of doing that. We also have administrators that are working with our social workers and our child welfare and attendance teams to make sure that they also go through and find some of the families that we have been missing. Then our greatest initiative that has just come up is we actually are working at using paraprofessionals to work at the local libraries. We have 20 libraries that have agreed to have our staff at their sites. So we are looking very, very forward to that work being done beginning this Saturday. And each of those libraries is going to have timeframes. Some of them are like from 10 to 5:30. Some of them are like 10 to 1:30. So there's different timeframes, but we will get that out to those communities and make sure that they know that they are going to have a tech specialist right there in their local library. And we did 20, so geographically we were able to hit all of the areas, particularly the areas that we were seeing some attendance challenges of students having more than 1 or 2 days absent. The other great news is that all the health centers are opening back up at our schools. We are very, very excited about this. We do have, they actually started today. So all of those health centers are back working for the students only. I just want to, make sure that there's a caveat there. But if there's somebody that's enrolled in the school that needs health services, they can use the clinic at the school. Estruma High School will open on September 8th. So they just have a different starting time. So all the other health centers at Broadmoor High School, Glasgow Middle, Glen Oaks High School, Estruma High School again on September 8th, Northeast High School that also provides services for Northeast Elementary School. So it's been some great work in shifting things out to the communities and making sure that the families actually have a chance to get something closer to them. Other district news, I just had to bring this up just because the summer went by pretty fast with all of the other work that we were doing, but we celebrated the Classified Employees of the Year awards, and I just wanted to share those with you. The nomination categories and the winners for that was in child nutrition. It was Natasha Gray from Southeast Middle School. We had maintenance, operation, and facilities, who was Maurice Wiggins at Melrose Elementary School. Office and technical, we had Tanisha Dunn from the pre-K office at the Kiel Center. And we also had our paraprofessional and instructional assistant recognition and award winner, Louise Young at Wedgwood Elementary School. And in transportation, we have Pamela Patterson, who is with, of course, our great EBR transportation team. So I just wanted to let you know how great we also are supporting our classified employees through this application and award process. So one other thing that's really important is we are going to celebrate the summer school graduation just a little bit differently this year. So this August 24th, we are going to be holding a diploma presentation at each of the high schools that have summer school students. Summer graduation that's happening on August 24th. So all the graduates are going to be doing a drive-by, and one car at a time with one of our graduates in it, and perhaps some of their family members. We'll go through the procession line, and each candidate would actually be given their diploma. Pictures will be taken, and all of those pictures will be sent back for us to make a virtual graduation picture ceremony for the students to have as a keepsake. So we're pretty excited about that. And we also just have another brief bit of good news from our finance officers, and they recently, just recently, they received the Government Finance Officers Association Award. It's a very, very prestigious award for the work that they have done. They are judged by an impartial panel, and they have to meet very high standards of the program of the GFOA, as well as the CAFR requirements for the fiscal year. So I just wanted to really take a moment to share and support our team in our finance and budgeting department. Just some great work by them. They also received another award where they also were recognized by the School Business Officials Association, and they got the International Certificate of Excellence in Financial Reporting. So I think there's just some great news out there about how great our department is in managing the community's finances and how well they are doing. So we just really wanted to make sure that you all knew that we are working very, very hard on the one-to-one. The devices are going out to the children. We have had some challenges with finding some of the community members, but we have the mobile hotspots. We also have the community hotspots where we have our schools that do allow parents and families to go and use the hotspots around our schools. Now we have the libraries, and also we have our community service team that's going out and working with our child welfare specialists to actually go out to the schools and find the children. So we're really looking forward to this continued work, and we also really appreciate the great work of the board in approving us to be able to get those hotspots, and some of our partners that have provided a significant number of those hotspots. So thank you.
It's very nice to hear. Next is going to be item E2, again for information only. That is the return to school criteria discussion. So I'll turn that back over to you and your team.
Great. Thank you, Mr. Godet. So we have been getting quite a few questions regarding a process or criteria for being able to reopen schools. It is a very complex process. It includes a lot of data. You all see all kinds of different data all the time. So we actually started a health advisory committee so that we have a specific team that can help us with making these decisions. We've been working with a number of doctors for really since March. And now we've been able to coalesce a team of doctors that we are beginning to work with. Well, we have been working with over the past month or so in creating this criteria. So we've got some really good processes started, and we wanted to share them with you tonight and make sure that we're headed in the right direction, and the community is able to hear also. Just a quick list. Dr. Michael Bolton has been awesome. He has been working with us all along. Of course, Stacy Dupree, she's going to kick this off in just a second. Sheree Duvac, the Director of Clinical Services of Our Lady of the Lake. Kristen Gradney, Senior Director, who does all the operations at Our Lady of the Lake Children's Health Hospital. And then we also have Dr. Dawn Marcel, and she is our Capital Area Regional Medical Director from the state. So. And one of our long time supporters and advisors, Dr. Catherine O'Neill, the Chief Medical Officer, and she is the doctor that's over infectious diseases at LSU. So I think we have some really strong people on our committee, and I just wanted to just personally thank them, as well as let the board know how important this team has been to us. So we have 3 people on the line with us tonight, so you will be able to ask questions of Dr. Bolton, Dr. O'Neill, and also Dr. Marcel if there's any health department questions that you all might have. Dr. O'Neill and Dr. Bolton are the ones that have worked specifically on the criteria, so we've got experts in all areas to help you answer any of your questions. So with that, I'm going to turn it over to Ms. Dupree. So thanks.
Hello. As Superintendent Brown stated, we have quite a team of experts and people in their fields to share with to help with the decisions as we move forward. As a parent of a child, I understand the struggles and the issues that many parents are going through to weigh the balance of a child's education and our safety. And that's something we kept in the forefront of our mind. So I just want to move forward to the next slide. And review the criteria. With our return to school criteria, there are a key indicator that we looked at to see what do we do, how do we move from virtual to hybrid and then to traditional. At the East Baton Rouge Parish, we are so eager to get our students back on campus. And as Superintendent Brown said, we created a health advisory committee, which is a partnership with Our Lady of the Lake Hospital and Louisiana Department of Education. One of the things we looked at in order for this to occur, to move from learning models, the East Baton Rouge Parish school system, East Baton Rouge Parish would have to see a decline in cases over a 10 to 14 day period. And we have 3 major areas that we're looking at. After any successive 10 to 14 day period of stable or declining cases, our superintendent would consult with the Health Advisory Committee to determine the cadence of bringing back other grade bands and to determine when traditional in-person learning is safe. The second area we're looking at is the transition to and future continuation of in-person learning will also be contingent upon a variety of factors, which may include the following: the number of local cases, our local hospital capacity, our availability of PPEs, cleaning supplies, safety materials, and adequate staffing for school and transportation functions. An additional thing that we are looking at is, should cases begin rising, the district will work with the Health Advisory Committee to determine the need for any adjustments back to virtual learning. And of course, we will continue to monitor the public health crisis, adhere to national, state, and local guidance, and make adjustments as appropriate. And our primary focus is to bring back the youngest students first as we're moving forward. Data for transitions will be reviewed frequently, and an update will be provided no later than September 1st. So as we move to the next slide, we only have a few slides. We wanted to be succinct, and so you would have time to ask questions. As you can see, this is a dashboard. It's from brla.gov. It's their dashboard. This is the number of cases that were on file on August 18th, 2020. There were 12,942 cases from March 21st to April 18th in the parish. One of the things we talked about in the slide is 10 to 14 day trends. So we pulled the data just to give you an example of what the 14-day trends look like. For example, July 2nd to 15th, there were 22,256 cases. On July 16th through the 29th, there were 2,739 cases. When you go to July 30th to August 12th, there were 2,132 cases. And of course, you may ask, why haven't we included the cases from the recent days? The reason being, as new data and information comes in, the numbers go up and down. So when I looked at this data 3 weeks ago, 2 weeks ago, each set of numbers has changed as we move forward. So what that tells us is that this is not the only indicator that we need to look at when we make our decisions. It is a key indicator, but of course there are other things. So as we move on to the next slide, I would like to ask Dr. O'Neill and Dr. Bolton to address these slides because they are experts in this area, so I'm going to mute my mic.
Hey, Stacy, thanks so much for having us both be able to be here with you all tonight. This slide is a regional slide. The state has 9 regions and puts out information day by day on how each region is doing, so you can use ldh.gov to compare each region against each other. What you can see here is that day to day cases are added back in as those results come back, and that's that blue part of the line closer to where we are at present. The orange are cases that are not new anymore but were previously reported. And so you can look at your 14-day trend the way Stacy showed you in the last slide for our parish, or you can also look at a 14-day trend for our region, because we do take kids in from a variety of different places, and also regional activity is going to affect our school system. So this is a little bit more of a broad view, but definitely gives you an idea of how things are doing in the greater Baton Rouge area. We are on a decline in number of cases, in our hospitalizations, in our ER visits for COVID-like illness. So far the region is looking good and has been for the last 2 weeks. We're not winning. There are regions who look better than us, but we're definitely improving over those July numbers that Stacy showed you.
So as we go to the next slide, this is a slide of percent positive and test volume. Dr. Bolton, are you available to address this slide? Okay, I think we're having some audio issues.
Hello, Stacy.
Yes.
Can you hear me? This is Dr. Marcel.
Yes, ma'am. Dr. Marcel, could you help with this this slide, because this is from the Louisiana Department of Health?
Correct. Yes, that's why I unmuted myself. I would like to do that, but I wanted to respectfully be sure that Dr. Bolton could not get in first.
Yes, ma'am. I appreciate
Can I proceed?
it. Yes,
No
ma'am.
problem.
Please do.
I wanted to say that as far as positivity goes, as a state, we're seeing an overall decrease, but here specifically in EBR, we are down at the most recent calculation, 11.7, which is under 12 and closer to 10. Ideally, we want it under 10, but that 11.7 is from the week of August 6th through August 12th, and prior to that, the previous week, we were 12.9. So we are encouraged that we do see our parish in EBR, our parish percent positivity rate coming down. We also have seen a decrease across the state, and we are down 8.8%. And we also just want you to know that we are also watching the surrounding parishes, as Dr. O'Neill was stating. While we are EBR, we certainly look to our neighboring parishes around the greater Baton Rouge area, because we know that we will be impacted. And with the numbers of positive reported cases as of today, just from the 18th, we are 13,133 cases, and we are the second highest for a case number in the state, second to Jefferson Parish outside of New Orleans.
So this is the data that we have. It's only 4 slides. I don't know if you saw Dr. O'Neill had to step away. She has, like all our doctors, are very busy. Thank you, Dr. Marcel. I'm so glad you're on the line so that you can help us with questions. But this is, as I said, this is for discussion. We want to be transparent where we are and how we're moving forward. So at this point, this concludes our presentation, and we are open for any questions that you have.
And 4 questions I would like to add that we also have another member from our regional team here at OPH. Her name is Emma Ortega, and she is our regional surveillance epidemiology. And Mr. Prey, I know you and Ms. Ortega work closely, but she is listening in on the call as well.
I'm very glad to hear that. She has been a great help to the district and to myself.
Yes, thank you for this been done. Mr. Howard has requested to speak.
Thank you, Mr. Godet. Thank you guys for your presentation. I have just a couple, well, not even a couple questions, but one question really. I know we talked about that we are looking at this as like trend data to see where we go and how we decide how we transition into our different types and models of schooling. And you mentioned in the presentation that there is a 10 to 14 day decline in days of cases before we can start to like reconsider. Is there an amount of decline that we're looking to see, like a volume of decline, or is there just like if it declines by a case or by a 1%, like what is the actual indicator of declining days? Because I mean, I've seen people talk about the declining day data, and then they kind of rush back into like transitioning, and then they have to start back over because of case overload. So I just was wondering, like, how are we looking to measure that? Thank you.
So
that's an excellent question. Oh, go ahead.
I was going to say I'm not an expert on this. I'm going to let Dr. Marcel answer it, but we do have to look at data and look for the significance. Is the data significant? Is the number of cases that have gone down, is that a significant decline in relationship to where we are? But Dr. Marcel, you're the expert on this, and thank you so much.
That is kind of you. I wouldn't say I am an expert, but thank you. And actually, I would lead in with what you were saying is that this is a key indicator, and the number of cases is a key indicator, but it in and of itself is not the only indicator. And Mr. Howard, that was an excellent question. First of all, we just want to see a downward trend. Sometimes even in a downward trend, there may be a day or two where there's a spike in a case, but if we can trace it to a specific event, but we still see an overall decline, that is still acceptable in that 10 to 14 day window. And we choose 14 days because that is the window of time that we expect the most infectivity of spread of people who do have it. And so as you continue to go down after a 2-week period, we don't expect it to suddenly increase. In addition to looking at cases going down, when we determine what is safe and when and how we can enter, we are definitely looking at our hospital infrastructure. You know, what is our ICU and just general bed capacity and availability in addition to vents? You know, depending upon where our numbers go, if we can anticipate that we will not decline, and in fact, there could be an increase, we really have to monitor as well in a 2-week period out, how many people do we think might be sick? And if they get sick, how many might require hospitalization? And are we, as a region, as a parish, able, I mean, in East Baton Rouge, we are a regional medical center with the Lake and with Ochsner and with Baton Rouge General. And what is our collective capacity to accommodate that need from a medical standpoint? So that too, in addition to numbers. The research that is currently available demonstrates that the use of masks and social distancing really do, and really the masks really do have an impact on the decrease in spread of this. And so while we have a mask mandate both at the parish level from the mayor's office as well as the state level, we are encouraged that with a decreased number, a sustainable hospital infrastructure, we can and will see numbers come down. Two things, and then I'll close on this one. One is with the masks or the state mandate. That is actually based on CDC data with tracking 100 new cases in a parish per 100,000 residents over a 2-week, over a 14-day period. And so we were around 400. An incidence of 400. So we were well above that 100 marker, but we were at the time this mandate was made, but we have been slowly seeing an increase, and that is encouraging. The one thing we do have to do is get through Labor Day. We have seen a measurable spike following Memorial Day, and then we were also quite busy and increased in cases after the 4th of July. And so we have one more big summer holiday to see what happens, and that is Labor Day.
Thank you for that information. I just wanted to ask that question just to get clarity for myself, and also because I know this has become like a political fight about when what we're doing as it relates to schools. So I just wanted to understand that the people can understand like what is like the true metrics to understand like when we're actually transitioning and like all of the things that we're thinking about. And there have been other people who reached out to try to understand what are the best metrics to measure actually going back to an in-person setting. So I thank you guys for the work of like actually putting together like science and actual medical professionals to make these decisions, and not like leaving it up to just, you know, people to make impulsive decisions based off what we should do. So I appreciate the work, and continue to work through this. Thank you.
Thank you.
Thank you. Thank you, Mr. Howard. I'm next in the list. The one question I have, and you
Mr. Goday has frozen, so Ms. Dyson, we'll start with you and go back to Mr. Goday.
Okay, thank you. I want to thank all of you who have been working on this, and I'll just go ahead and say it. I had a pretty bad case of it myself and others in my family, and And so I thank you very much for your work on this. I know just how serious this can be, and yet I know that I am also feeling that we need to safely open as soon as we can. So I have a question, and I know that Ms. Dupre touched on it, but I wasn't quite clear. And she said that she stopped and we didn't have the most recent 10 days with it the 20th today. So like from the 10th or 9th through, say, 9th through 19th. And I wondered, so we're doing these in 10-day increments, and I know we're on a decline. So do we have a number of days that we're staying low right now? Like, are we on a 10-day potential count? And how will that fall out as far as if we don't have a spike, and the thought of after Labor Day?
I think,
and I don't know who wants to tackle that.
This is Dr. Marcel, and I think as far as how do we attack it after Labor Day, we truly have to follow the data. I mean, while we will have a plan, and similar to the response to Mr. Howard's question, you know, it's multifactorial, and we will take different factors into account, but we really can't know what we will do until we see what we have before us. The information from Ms. Dupre's presentation was from the mayor's office, she stated, and I track it daily from LDH. And right now we are not consistently decreasing. We're not on 10 days. I'm happy for 2 days, ma'am. If I see a 2-day decline, I am excited for us, because that doesn't get us to 10 to 14 days where we can look at it, but it is still hopeful. Right now we are holding steady, but we are not at a decrease. But today is only the 20th. Labor Day is in September, so we still have a window of opportunity to see a quantifiable objective decrease in numbers. But right now, we're not there.
So we haven't started a 10-day count yet, or a 14.
No, there have been days. There have been some days, you're welcome, that have been less than the previous day. But no, ma'am, we do not have a trend. And I wanted to say that I am glad you are recovered.
Thank you so much. You can't take this too lightly. I just can vouch now that you don't truly understand until you're there, and it wasn't pretty. So I just say and I was following all of the masking and the things that were being recommended, and so were my family members. So it's just a really dangerous virus out there, and it can be. It's really strange how it'll take some people and affect them so differently than others. It's you know, you can hear the stories, and they're true, from some people that have a few little symptoms for 3 to 5 days, and then you have quite the opposite. So I have a different understanding of this now, and so we do have to do this safely, but at the same time, I do feel a sense of urgency. So thank you for your continued work on this, and for your answers tonight, for being and joining us. We appreciate your time and expertise.
Thank you, Ms. Dyson. I'm assuming you can hear me again now. A couple of quick questions and a comment. Ms. Dyson, one thing remember is that the data they're showing now is shown by date of test, not date of result. So it takes some tests come back in the same day, some tests don't come back for 7 days. So that's why you have a lag in determining the numbers. But LSU, Southern, and BRCC are all coming back, and they will be coming back in force right about the time we'd be looking at doing some things. Is there a program or process with the state to focus in on the colleges and universities to make sure that they don't drive another spike. If I don't need the intimate details of it, but could you just talk a little bit about what might be done to monitor, particularly at the colleges and university level?
Well, the short answer is, will there be something done? The answer is yes, and we've already started. In addition to recommending the mitigation efforts that we have always expressed, we do realize they are college students. And if you recall this summer, when the athletes returned to LSU's campus per SEC approval, we did have an outbreak at the end of June here. And so we are very cognizant of it and sensitive to that, and have been working individually at the regional level and at local hospitals with the universities, but also at the state level. We have community-based testing available, and we are certainly focusing our activities on campuses and recording cases. The Department of OPH, our agency, is working really closely with the Board of Regents on a regular basis, and we did not just start. This has been from the onset of this since last spring. So senior leadership within OPH and the Board of Regents is in regular contact. And also along those lines, we had federal surge testing through FEMA. FEMA selected 3 sites in the country: Houston, Texas, Jacksonville, Florida, and Baton Rouge, Louisiana, because our numbers were that alarming in the increase. And so with that, there is now surge testing in New Orleans, and we are able to use some of the remaining tests at Southern and LSU, and that is actually starting today and tomorrow, as the students come back. And we also are discussing other plans with university administrators and athletic departments to have site-specific or school-specific, university-specific plans. Yes, sir.
Thank you very much, and thank you for all the work that you're doing. Mr. Ballou.
Thank you, President Godet. Just, I want to make sure I understand the criteria. The 10 to 14 days, is that a rolling 14-day average that's being used, or is it just straight cases?
It's primarily cases and looking at the incidents or the new cases being reported, whether or not we see a trend in a decrease of newly reported cases. But it's not exclusively just a downward count in cases themselves. We are looking at percent positivity. We are looking at hospital infrastructure and bed availability and capacity, because we have to be sure that, if the trend doesn't last, or if cases increase again, that we are in a position from a medical standpoint to accommodate the needs and serve people who may get very sick. Some people may be completely asymptomatic. Some people can have a truly life-threatening illness from this. And so just being sure on multiple levels that, in addition to seeing the incidence of new cases decline, that from a multifactorial standpoint, we can support from a public health perspective and from a medical perspective. I wouldn't say re-entry, because we've re-entered, but continued entry. But I would say, though, with that, even if we see a decrease in the numbers and we see more activity out in public, that is not to say now that our numbers are down, we can go out and we don't need masks anymore, or we don't need to socially distance anymore, because we do believe, and research supports, that the use of masks does decrease the spread. And so from a public health standpoint, we do believe that going out and increasing our activity out of the home, even with a decreased incidence, will still include or need the use of masks and hand washing and social distancing, even as we go out and cases decrease, to keep the numbers decreasing. In other words, if we see a decrease, we go out, we increase mobility, we don't implement these public health measures to mitigate it, we would expect it to increase again, and we would expect yet another spike.
I think it would be helpful for families in our school system if we had a clear measure that they could follow along and be confident that once we reach this point, our schools will be able to open. Would it be more useful to track maybe a 14-day average on hospitalizations? Would that be an easier or more useful measure?
Yeah, none of this is easy, and it alone in and of itself is not necessarily useful, because everybody who's positive doesn't require inpatient admission, and every inpatient admission doesn't require ICU or a vent. We look at the entire picture, and if we could neatly wrap it and present it in a way that would be absolutely clear, we certainly would. It would be helpful for us as well. But this is a novel coronavirus, novel being new. Even when it came, there was a concern that or a question or thought that it could possibly have seasonal sensitivity and decrease in the summer. We know that's not true, and so we are still learning so much. But what we are doing is sharing what we do know, and some of this is based on the virus. But then when we go back to just standard public health measures such as the social distancing and hand washing, we are continuing to do those as there is still medical research in medications for this and vaccine research as well.
Okay. Well,
hey, Michael Bolton, I'm not sure if I'm.
Oh,
can y'all hear me now? Okay, thank you. I apologize. I didn't mean to interrupt. Just to add to the good comments that Dr. Marcel and Dr. O'Neill made earlier, I could, as a data person, I could certainly understand the need to have a very clear, very objective measure to use to say, yes, it's now good to go back to school. We have a 2% decline or decrease of 1,000 cases on a daily basis. But I think part of the agility, of us trying to determine the feasibility and the safety of making that happen is somewhat subjective to some degree, because if we say we're going to decline by 1% of cases, well, it's somewhat relative to what the prior 14, 21, 28-day cases look like. And if we say we're going to decrease by 50, well, is that 50 from 10,000 a day, or is that 50 from 100 a day? And so it makes it somewhat difficult to sort of, put us in a box to say, if we meet this one criteria, then it's okay to open. But as Dr. Marcel and Dr. O'Neill noted, there are going to be other factors considered into that decision of allowing schools to go back in person. And so I certainly see the need or the desire to have a very clear cut line of exactly what needs to happen in order for schools to go back, but it's somewhat of gray lines to some degree based off of what we see in the region and in the state and in the hospital capacity.
All right, well, thank you.
Sure.
That was Dr. Bolton, just in case y'all didn't know. Thank you, Dr. Bolton.
Thank you. Mr. Lannis is next up. Mr. Lannis? Cannot hear you. Mr. Lannis, you're on mute.
Can you hear me now?
Yes.
Okay, sorry, I had some technical difficulties. Apologies. My question is, with everything that we're hearing right now about possible spikes, how many days we should see no cases or no new cases before we consider opening schools back up? But is there a strong suggestion around how we approach our families as it regards testing? I think that's one of the strongest key indicators that can let us know who could possibly have it, but also get people's mind in sync of how important testing is so that we can know who could possibly be infected inside of our schools, but not just around our schools, but all around our city to help keep spikes down. Next question
this is Michael Bolton.
The medical professionals, by the way.
Yeah, no, thank you. Thank you for your question. And just to clarify, your interest is in just testing overall, or testing families of kids in a public school system in particular? I just want to make sure I want to answer your question as best I can.
All right. So more specifically, we have a lot of people who are under East Baton Rouge Parish school system, and I'm just talking about our school system as a whole right now, because I know that it could affect, that this also affects our entire city as a whole. So my question is, should we be strongly suggesting our families, meaning any students, parents also, because those students are virtually learning at home or distance learning, educators that are inside of our building, or any of our employees, should we be strongly suggesting to them that testing is a high priority right now?
I gotcha. Thank you. And I can speak for a second, and Dr. Marcel could probably give a much more eloquent answer from a standpoint of public health. But yes, testing is a very important piece in order for us to identify folks who have the novel coronavirus. It's important to have testing done. As you've seen over the months, testing sometimes is easier to come by in some places as opposed to others. Depends on the supply and resources and availability and access. But yes, testing is a very important piece of us identifying where folks are positive, where hotspots might exist, where we can do a better job of containing the virus, as opposed to having more widespread actions that are of course very needed to blunt the growth of this virus spread. And so testing is an important piece. And I don't know that we would necessarily make it a proactive piece to test asymptomatic folks, but certainly those who have symptoms that are somewhat consistent with COVID-19, those who may have been exposed to someone with bona fide COVID-19, and you can make the argument even for those latter folks that they would be considered infectious or infected if they live with someone who has COVID-19. So to shortly answer your question, yes, testing is an important piece. It's just a matter of how to operationalize that on a more broad basis.
Has there been any consideration around it, about how we can make it more broad as we have more talks around reopening schools?
I have not been involved in discussions of doing more widespread testing. I know the mayor, I believe, I'm sure Dr. Marcel has been in a number of discussions with Department of Health as far as that's concerned. We at the Lake have been doing testing from a clinical standpoint, not necessarily from a school-based perspective. But I don't know if Dr. Marcel can speak to that maybe more specifically.
I mean, the short answer is testing important, and what you were asking about testing your families, the answer is yes. We believe that the more we know, when we can identify where it is, we can isolate and quarantine when necessary to other measures of mitigating spread. Specifically, as far as testing in schools, we have not independently made decisions towards that with LDOE as of yet. And I think that will be something that this committee will be addressing as we get closer to school, and looking at the school-based health centers on site and what that would look like. What I would say too regarding testing is that testing, when you start to think of on-site testing, and we look at the different types of testing available, that it is important to be clear on what type of test we're talking about as well when we say testing on site and begin to speak to testing in schools. Is that what you were asking, sir?
Yes, ma'am.
About testing in schools? Yes. And so I think another piece of that would be what type of test would be available on site in a school setting, and what would its usefulness be? For example, diagnostically, using antibody testing would really not be highly recommended for that purpose, but there may be another context that you could use that test to decide. And so it's not just having a test. Dr. Bolton, would any of the observations at LKA right now, would that be applicable to this? Do you think?
Yeah, Dr. Marcel, that's a great point. And, first to your point of deciding what type of test to use, to the gentleman's question, is true, right? Like, antibody testing is really of no value at this point from a school setting standpoint. It's really to, as you said, identify those who might be infected actively with COVID-19, who could then spread the virus to their peers or their classmates or fellow teachers. We have partnered with Louisiana Key Academy in town, and under with the support of LDH and Pennington Biomedical Research Center, we are, to the gentleman's point, actively testing kids and teachers at that school on a twice-a-week basis using saliva, which has come out in the news recently, and we've been doing this since the beginning of July. It's both Cherie Duvik and Kristen Gradney, who are on the call, have been very vital aspects of making that happen, and we're sort of looking at this as a surveillance activity to determine what testing looks like in a school setting, and how the virus may act in a school setting, and in particular in a school setting that, as Dr. Marcel noted, can implement the safeguards that are evidence-based, including wearing masks, watching your physical distance, and washing hands, how the virus acts in the congregate settings such as schools. And preliminarily, we've had, knock on wood, fairly good success with this program. And we've been very happy so far with the outcomes of it so far. The caveat, certainly though, is we're looking at, I believe, just under 200 students that we're doing on that are being involved in this program at Louisiana Key Academy, which is certainly a much smaller slice than what I believe Ms. Brown mentioned of 40,000 kids in the East Baton Rouge public school system. And so to operationalize something like we're doing in the Key Academy, I think would be great. I think it's just being able to identify steps to take when you implement something like that and the resources needed to get something like that off of the ground. And so it would be great if we could do it, but then I certainly wouldn't want to step on the toes of educators and the professionals in the school to do what you're supposed to do at school in the first place. I'm not sure if that answers or helps at all, but I'm happy to do follow-up questions or, yeah, thank you.
Oh, thank you. I'll ask the question because I just think that now's the time that we start facilitating more conversations around testing as it regards people coming back inside of the buildings. But thank everybody. Thank you for the hard work, the diligent research that has gone into this. I appreciate everything that you do, and I'm sure the rest of our board members does as well. Thank you.
Thank you, sir.
Yes, sir. Thank you.
Thank you, Ms. Dye.
Two more quick things. We are hearing things about that the state is recounting re-positives, like if a person tested positive and then they test again and it's still positive. Have we gotten, have y'all resolved that if it was an issue at one point. Has that been resolved so we're getting an accurate,
I'm not sure that
new test?
Exactly.
True new
I'm not sure
positives?
I'm not sure what situation you are speaking of specifically that we've heard about, but what I do know is that we are clear that what's being reported are new PCR cases.
So if someone had a retest and was positive again, it would not be counted.
Correct.
Okay.
Correct.
And
oh, go ahead.
And then the other thing I was going to ask is, so in this conversation tonight, I've heard about the percentage of positives on, and I'm thinking, so there was this real community outreach where, you know, the lines at the testing sites for free testings were, you know, just very lengthy, and so many tests were being done. And I don't see those long lines anymore. So I'm thinking if we're not testing as many, then the percentage would grow because it would be less of the whole or more of the whole being tested. So can you speak to that, please?
I'm sorry, can you please repeat that first?
I'm trying to figure out how to be clear. So if we are working on, and one of our criteria measures is watching the percentage of those testing positive to the percent or to the number being tested. As our testing sites look and appear less crowded, less numbers of cars in line, and so if we're testing less, is that going to inflate our percentage of positives?
No, it won't falsely inflate your percentage of positives, because even if you test less, if people are positive, you'll get 0% positivity.
But if you're testing like big masses and you have that same number, around that same number, then your percentage of the whole is less, right?
Yes, but yes, if you have a larger number, then that percentage of the whole will be less. But still, it's not, the reverse is not necessarily automatic. It's not conversely true, because still, even if you test fewer, if people don't have it, you would still get 0%. I understand now what you're asking or why you're asking it, but no, just because if you have more, that percentage would be smaller. No, that does not, the converse does not inherently apply. But I get your question, and it is a good thought and a good way of looking at it. But at the end of the day, if it weren't prevalent and if people didn't have it, regardless of how many or how few tests you perform, you would get negative and you wouldn't get positive. But I do understand your question. And we did notice at one point early in August, there was a decrease in our testing overall, but also we would like to think that you saw fewer lines because we got more efficient as well, and we were able to expand sites for testing.
So is the total testing number, though, going down?
We are still increasing. It has gone up and down. But in EBR, like in the month of July, just at our surge sites alone, we did 20 to 25,000 tests just there. And we had a state goal set in May to do at least 200,000 tests a month. And so we did meet that goal in May. In June, we almost doubled it at 385,000. And July was even more. So collectively, even though we're seeing like some decreases at different sites, we still are doing a fair amount of testing. And Louisiana is actually one of the has one of the highest testing rates of any of the states or U.S. territories. I can't give you the exact number, but if you're interested, I will. But no, we
Thank you
test.
very much. Okay, thanks.
Mm-hmm.
Thank you. Mr. Ballou.
Thank you. I had forgotten to ask one question earlier in regards to criteria. Does the CDC provide any guidance in terms of criteria for opening schools?
Through the
it's
chair.
Mr. Bolton.
Oh, thank you, Mr. Dr. Bolton.
Oh,
Yeah,
I'm
so,
sorry. I was just talking. Go ahead. I'm sorry.
Oh,
I was
no,
on mute.
please, go ahead.
I'll go back on mute and then.
Yeah, I was just going to defer to Dr. Marcel for the most part because she likely has more direct contact with the CDC than I do. When I've read the CDC recommendations, I'm not aware of a particular number. Okay.
You are correct. They do not have any strict, concrete recommendations as they may have historically had in different situations. There are guidelines and recommendations, but really not any strict requirements at this time. Doesn't mean there won't be, but they do have information on opening schools. They are in support of kids returning to school. The thing is returning to school safely. But yes, they do have more so than guidelines. I would call information on. I would refer to as information on their website that is helpful, and I do recommend it.
All right. Thank you.
You're welcome.
So through Mr. Godot, the president. Mr. Godet?
Yes.
This is Mrs. Brown. Yes, thank you. I just, during this conversation, I just want everybody to really understand that this Health Advisory Committee, as well as our staff, absolutely follows the CDC guidelines or exceeds them. And just like Dr. Marcel said, they are more informational of things that they recommend that we do. We are following them very, very closely, but they do not give any, specific data as to when we should reopen school. And that's why we really started this conversation about looking for data that will help us make decisions effectively and very, very safely. So that's what this conversation really is headed towards, is trying to set some markers or gating criteria so that parents have a good idea of how we're following the data, how we might make decisions, and all the different conditions that go into making that decision. So thank you. I appreciate your question, Mr. Ballou.
And thank you, Superintendent Brown. I appreciate your comments. And likewise, we use the information available within LDH in the same way EBR PSS does. And we are in contact with them, and we are able to look. We are learning more about our community, and CDC is a wonderful resource for us, but to Superintendent Brown's point, I do not have to add to that, but that is where we are, and we are doing what we can with what is made available.
Thank you very much. Welcome, Ms. Collins. You're up next. Ms. Collins? Cannot hear you. There we go.
Okay. Just real quick, can we lift up again the lag time and its impact on the data in terms of, okay, the data reflects the data test was taken versus, okay, the data is being reported today. That's not necessarily what's happening today, and how that would impact, you know, us looking at the 14 days. Was my question clear?
Yes, it was.
Okay, all right.
This is Mike Goday. Just in the absence, you know, the way I look at all these numbers in there, to keep posting the 7-day average, because it's hard to look at individual days because you got weekends in there. No numbers are reported on Saturday. So I've been looking at the 7-day average as what to take. And that 7-day average has a lag time because you're going to have days in the front end of that haven't been reported back yet. So you basically are looking at a 7-day average with about a 7-day lag time built into it. So you're looking at what happened last week and a 7-day average of that. So I think that's about the best you're going to get, because if you try to do anything else within that, you're not going to have complete data, or you're going to have so much bouncing around in there just from variations of weekends. And you can see Monday and Tuesday tend to be high, then they fall off Wednesday, Thursday, Friday. It seems like every week follows that pattern. So now I'll be quiet and let the people who really know something about it say something here.
Hey, it's Michael Bolt. That's a really good way to put it. I don't know if I could add more words to what you said to make it more clear. Yeah, there's just a lag time with getting the data available to be able to review at a regional, parish, and state level.
And so your comment was the best response to that question.
And so then when we talk about looking at a 14-day decline, is the reason why it's a 14-day decline? Does the lag time issue, is that reflected in the number of days of decline we're trying to get? Or do we have to also consider there's a lag time when we're looking at 14 days?
Hey, it's Michael Bolton again. Yeah, no, you're right. That was part of the reason we sort of provided a bit of a cushion with sort of the lag time baked into that idea with that time frame. You're absolutely right.
Okay, thank you.
Thank you. Again, I see no other people requesting to speak, so I just want to thank all of you in the medical profession for all of your help working through this, and look forward to continue working with you until we get past this. And like I'm saying in every email I sign now, I say stay safe and pray for a vaccine, because that's what we really need, is a vaccine. So with that, we will move on to the next agenda item, and that is the dialogue on race. And before I give it to Ms. Ware-Jackson and Ms. Collins to talk about, I just want to thank them for the work that they put in there into this process, and recognizing that we're working on the resolutions that we passed by the board, and following up on this to take positive concrete action is greatly appreciated. So with that, I will turn it over to you ladies.
All right. Thank you, Mr. Goday. Thank you, Ms. Collins. And I appreciate our board being very bold and brave in agreeing to have this series, the Dialogue on Race series, in place. As Mr. Goday mentioned, our board passed a resolution which speaks of our commitment to equity in eradicating racism in education. And I would ask the members of the public if they would like to take a look at that resolution. I believe it's still on board docs from last month's board meeting. In that resolution, you know, we speak about education as the key lever for creating a more equitable nation and world, and a tool for dismantling institutional racism. And the fact that our community and nation's future require that this systemic institutional bias be dismantled to promote equity and ensure all children and families are able to thrive. Also inside the resolution, we commit to reviewing and revising our existing school board policies over the course of the 2021 school year, which will be upon us before we know it. And so there are a lot of things that we want to do in the near future, and having this series of dialogue on race will definitely help us in our efforts to move the district forward according to that resolution. A little bit of background on this is that Dialogue on Race Louisiana did a full day seminar a few years back, and the makers of that event were looking to do another similar event this fall in October. So last fall, in 2019, this group of higher education leaders representing the local colleges and universities, along with nonprofit leaders, came together with some of the members of our administration, our EBR PSS administration, to discuss a joint effort in contributing to the healing process around race in the city of Baton Rouge. And as education is the foundation of the future for this region, education leaders can play a vital role by taking the lead in these conversations around race in the education sector through the use of a facilitated format that provides a safe space for sharing and understanding, where we can get together and not be afraid or feel fragile about this conversation. So meetings began, the planning meetings were interrupted by COVID after a few months of meeting to put together the day of dialogue, and also put together a 6-week series on dialogue on race that would be geared specifically to education. And we were interrupted by COVID-19, but began again in June in a virtual setting. And Ms. Collins joined us at that time. And since then, we have come up with some dates and some action around facilitating the event. I need to say that the dates are limited due to the high demand right now for this series, not only from the local area and within this region, but because of the very practical and good feedback that the series has gotten. There are entities in other states that are asking for some help in facilitating this kind of discussion and duplicating the series in other states. So the results of the planning, we came up with a 3-phased approach with events beginning in September as follows. A general overview presentation of dialogue on race to the school board and our education peer groups would be in a virtual workshop presentation for information only on Thursday, September 10th at 5 o'clock. And the second phase would be the 6-week series of dialogue on race specific to education. Is open to school board members, administrators, and our education peers from LSU, Southern, BRCC, and the charter boards, local charter school boards, would be part of the series. There would be 3 groups in a virtual setting consisting of no more than 15 total participants, and each group would consist of no more than 3 EBR school board members, and the remaining seats would be occupied by our education peers. The 3 sessions may be offered simultaneously or at different times of the day, beginning on Wednesday, September 23rd, and each Wednesday thereafter for 6 weeks through October 28th. The series is available for additional groups and administrative staff and teachers as well. Those series would be offered a little later, and most likely, well, some of them could run simultaneously, but the priority was for the boards of higher ed, K-12, and charter school boards. So each session would cover a major activity around race in the country, how race was constructed, who are its beneficiaries, how it operates, the movement to end it, the controversial affirmative action toward improvements, and why talking about race matters. Now, for more details about the how each session is constructed, I would recommend that you go to dialogueonracelouisiana.org/original series to get more details about each of the 6 weeks sessions. And then the third component is a one-day event called the Day of Dialogue on Race in Education that will occur on Friday, November 6th for educators and other interested parties to attend, and there would be a report back to the education leaders as part of the plan. And I think this is very important in that we will be able to have the voices of people all over the district and other, people that are really, just part of the education sector, and to get their feedback that will help us as we look at our policies and procedures, and when we also take another look at our strategic plan. And about the press, with regard to the press, as discussed in the planning sessions, we'll have a media release regarding the Day of Dialogue on November 6th, and Maxine Crump with Dialogue on Race would prepare a message and guidelines for any persons in the media who may want to inquire about the DOR series itself. The cost of the presentation is $1,000, and it may be split between all of the groups if needed, and the cost of each participant is $50. And I'm wondering, with COVID-19 limiting our travel, perhaps we could use some of this professional development budget may cover some of these costs. And what I've done so far, as far as that that group that was working, everybody had different assignments. My assignment was to engage the board and to reach out to our charter schools, the EBR group of charter schools, and I have done that. I've reached out to BASIS, CSAL, Emerge, IDEA, Inspire, J.K. Haynes, Mentorship, and even South Baton Rouge Charter. I've heard back from a couple of them already, with very excited and just eager to get this information to the rest of their board. And I've also been in touch with my Bessie board member, Preston Castile, who was able to send some of the information to the Baton Rouge area charter schools last Friday. The Louisiana Public Charter School Association. So the word is getting out to not only our charters, but the other charters in town. And so far, the response has been very positive. And what we'll need to do is get our commitments from our board members to see, you know, what time of day would be preferable, because there will be like 3 different groups, and we'll need to split us up, divide us all so that we can participate at the time that is best for the particular board members. So, Ms. Collins, is there anything that you want to add? You've had some experience with dialogue, haven't you?
Yes. Many moons ago, I was a facilitator, and I've participated in some. In fact, I had participated in the one that you mentioned earlier that had a focus on education. A former board member was part of that, Parish Robinson, and it was very good and very informative. I just want to lift up and just put it on the table. Right now, racial tension is high across the nation. And if we can't even just have a dialogue to talk about it, then I don't see how we get past this moment. This is just an opportunity to make sure that we are speaking with the same terms, and we understand each other when we say something. Different people have different definitions for racism, prejudice, systemic racism. And so it's important that as colleagues, as community members, the broader community, the leaders in the broader community, is important that we are at least speaking the same language when dealing with this sensitive issue, because sometimes we get offended when it's nothing to be offended about. I mean, and so I hope that people are encouraged. I hope the broader public understands that when we say we're participating in dialogue on race, that it is genuinely about a dialogue. It's genuinely about a dialogue. And this particular program is highly vetted. As Evelyn had already mentioned, is in high demand, even outside of the state of Louisiana, and from different and diverse community groups, organizations, and businesses. It's not just people of color utilizing this program. It's people that are not people of color requesting this program. A few small examples: Baton Rouge Art Gallery has gone through it, Taylor Posa, as well as YWCA. So please be open-minded. I know racial tension is very high right now, but that's even more reason for us to have these dialogues. And that's it.
Thank you very much. If there are any comments from anyone, I'm not seeing anyone with a request to speak. Thank you for the work that you two have put into this, and look forward into starting off this process and moving us along. Appreciate it very, very much. Next, we'll move on to item F1, reports from appointees to committees and agencies. Do any board members have any information they'd like to share with the board? Seeing none, now we will move to the consent agenda. Mr. Ballou, would you please read the consent agenda?
Yes, just give me a second to pull it up here. All right. The following items to be approved as part of the consent agenda. Item number 2, consideration of a request for the approval of the Cox Charities Innovation and Education Grant in the amount of $12,688 to provide direct service classroom projects. Item number 3, consideration of a request for the approval of the following budgets. A, Strong Start, Governor's Emergency Education Relief Fund in the amount of $765,000. B, 2020 to 2021 Believe and Prepare Formula Transition Budget in the amount of $5,000. Item 4, consideration of a request for the approval of a professional services contract between the East Baton Rouge Parish School Board and the following. A, Nearpod in the amount of $17,984.62 to provide social and emotional learning software. The funding source is Strong Start. B, Career Compass in the amount of $290,000 to provide individual college and career coaching. The funding source is Strong Start. C, XL Connections, LLC in the amount of $40,000 to provide coaching and professional learning. Funding source is Title III. D, Board of Supervisors of Louisiana State University and Agricultural and Mechanical College on behalf of its Louisiana State University Health Science Center in the amount of $50,000 to provide specialized supports for educators to meet the unique needs of students with disabilities. Funding source is IDEA. E, Baton Rouge Children's Advocacy Center in the amount of $40,000 to provide professional learning and support. Funding source Strong Start. F, School Specialty in the amount of $17,153.70 to provide professional development and support. Funding source School Redesign. G, the Avid Center in the amount of $65,506 to provide support and professional learning. Funding source is School Redesign. H, Illuminate Education in the amount of $123,378 to provide Fast Bridge Assessment System annual subscription. I, Illuminate Education Incorporated in the amount of $20,000 to provide the Horizon ACT College Readiness Package. J, City Year Incorporated in the amount of $180,000 to provide youth development and education support services. K, Infrastructure in the amount of $32,658.60 to provide Canvas Cloud subscription for faculty. Funding source is the technology budget. Item number 5, consideration of a request for the approval of a memorandum of understanding between the East Baton Rouge Parish School Board and the following. A, University of Louisiana at Monroe to provide dual enrollment courses for the 2020-2021 school year. B, Southern University to provide dual enrollment courses for the 2020-2021 school year. C, BRCC to provide dual enrollment courses for the 2020-2021 school year. And D, Southeastern Louisiana University to provide dual enrollment courses for the 2020-21 school year. And E, LSU to provide dual enrollment courses for the 2020-21 school year. Funding source is the Supplemental Course Academy. Item number 6, consideration of a request for the approval of the renewal of the agreement between the East Baton Rouge Parish School Board and Oshmer Clinic Foundation in the amount of $60,000 to provide athletic training services. Item number 7, consideration of a request for the approval of a memorandum of understanding between the East Baton Rouge Parish School Board lead agency and select center partners via the following grants. A, preschool development grant for the expansion of the 3-year-old program with a per pupil allocation of $5,780.04, not to exceed $450,843.12. B, LA4, Cecil J. Picard grant to participate in the annual pre-K4 program with a per pupil allocation of $4,580, not to exceed $458,000. Item number 8, consideration of a request for the approval of the following school board policies, policy revisions, and related matters. JAAA Title IX Grievance Procedures, JCEA Student Sexual Misconduct, GAMC Investigations, GAEAA Sexual Harassment, GAAA Equal Opportunity Employment, and GAE Complaints and Grievances. Item number 9, consideration of a request for the approval of a contract between the East Baton Rouge Parish School Board and the following. A, HCS Baton Rouge, DBA Helix Aviation School Operators. B, HCS Baton Rouge, DBA Mentorship Legal Academy Operators. Item number 10, consideration of a request for the approval of the Student Rights and Responsibilities Handbook and Discipline Policy for the 2020-2021 school year for the East Baton Rouge Parish School System with noted changes. That concludes the consent agenda, and I move that it be approved.
Thank you. Before we move on, Mr. Shamlin has requested to address an item on the consent agenda. Mr. Shamlin.
Yes, thank you, President Goday. Mr. Blue, you did an excellent job reading those many items into the record. You do need to go back and indicate that these previous items are considered to be routine and will be enacted with one motion. I think you might have missed that in reading. My board secretary caught it as well. But just to be sure we're covered that this is one routine item that'll be enacted with one motion. If you could read that statement into the record, that would be great.
If you don't have it available, I have it.
You're on mute, Mr. Ballou. I'm sorry, Mr. Ballou, you were on mute. Could you restate that?
All right. The following items are to be considered to be routine and will be enacted with one motion. There will be no separate discussion of items unless a board member so requests, in which event the item will be removed from the consent agenda and considered as an item on the regular agenda for a separate vote preceding the last item on the regular agenda. I think that covers it.
Thank you, Mr.
Okay.
Yes.
All right, thank you.
Thank you, Mr. Ballou. And I have the request to speak. I request to pull item 6, so I may recuse myself. Ms. Ware Jackson, you have a request to speak.
Yeah, I'll second that motion. And I'd also like Mr. Shamlin to just review the changes with those policies. Or
Okay,
the additions.
So would you like
yes.
to pull the policy? Would you like to pull the policy one?
If
That
it's
is
not
item-
necessary to pull it out, we don't need to pull it. I just would like him to review it so that the public will understand what's happening with any policy revision.
Yes, ma'am. I can do that after we've completed any request to pull items, Mr. Goday.
Yeah, so we have a request to pull item 6, And so the motion would be to
Mr. Godey,
to approve. Yes.
I need to also request to pull 9
Oh,
and
I'm
10.
sorry.
That's okay.
9 and 10. I'm sorry. I saw your name up there and I didn't do it. 9 and 10. Okay, so that handles Miss Ware Jackson's. My apologies, Miss Collins. I
That's
saw
okay.
your name up there and forgot. So the consent agenda up for approval is the consent agenda minus items 6, 9, and 10. So, Mr. Blue, I assume you make the motion?
He made
Yes.
the motion and Ms. Ware Jackson, I think, seconded.
Okay, so we have a motion and a second. So do we have any comments on the consent agenda minus 6, 9, and 10? I am seeing none. I am refreshing the comment list right now. There are no public comments on these items. So we'll go back to the board. Seeing none, Madam Secretary, would you please conduct the vote?
Mr. Godey, do you want me to address those policy questions briefly prior to a vote or after?
Well, that item has been pulled, so
Okay.
it will come up. It will come up anyway.
Okay.
I think
Please.
that it has been.
Yes, sir, that's the item that was pulled.
Okay.
Well,
Please
there's
vote.
yeah, 9 and number 8, Ms. Jackson, was your comments on item 8 or item 10?
Item 8.
Item 8 was not
Okay.
pulled. Yes, item
No.
8 was
Not pulled. So go ahead, please, Mr. Shamlin.
okay. In response to Ms. Ware Jackson's questions on policy changes, these are all related to changes at the federal level. Essentially, we're dealing with Title VII, employee sexual harassment, Title IX, sexual harassment, and sexually related student misconduct. The previous student sexual harassment policy has been revised and retitled as sexually related student misconduct, and a new comprehensive Title IX sexual harassment policy has been developed. This new policy provides a number of things. Among those things, required policy notice that the school board does not discriminate on the basis of sex in its education programs or activities, and that it operates and that its response to actual knowledge of sexual harassment shall be prompt and not deliberately indifferent. It provides for new definitions for the appointment of a Title IX coordinator, which we already have in place. It also provides for the required response to actual knowledge of sexual harassment events and incidences, including developing supportive measures for both victim and accused, investigatory procedures and grievance procedures, requires certain record-keeping provisions to meet requirements, the new requirements on the Title IX sexual harassment documents that must be maintained for a minimum period of 7 years. And also there are new retaliation and confidentiality provisions, basically provisions prohibiting retaliation as required by the regulations. Because Title IX sexual harassment is now addressed separately, the employee sexual harassment policy has also been revised to limit its scope to prohibitions contained in Title VII of the Civil Rights Act of 1964. We're also revising policies related to equal employment opportunity, non-Title IX complaints and grievances, and investigations to reflect that all Title IX sexual harassment complaints are to be addressed under Title IX sexual harassment policies and procedures. And we will be bringing training to the district staff in the coming month to address these changes, and also reviewing protocols to make sure our practices are aligned with policy and law.
Thank you, Mr. Shamlin.
You're welcome.
Okay.
Thank you. Are there any other discussion items on the consent agenda? Hearing none and seeing none, Madam Secretary, would you please conduct the vote?
Please vote. Ms. Collins, give me a second to fix this so you can vote. Guys, I'm gonna have to cancel this vote. Give me 1 second. Sorry, guys, now vote. Mr. Blue,
Yes.
Mr. Lannis,
Yay.
Mr. Howard,
Yes.
Ms. Collins,
Yay.
Ms. Ware Jackson,
Yes.
Ms. Dyson,
Yes.
Mr. Gode,
Yes.
Ms. Bernard,
Yes.
Mr. Tatman, the motion carries.
Thank you, ma'am. Now we will move back to item 6, the athletic training service agreement. And at this point, I will recuse myself and turn the gavel over to Mr. Howard.
Thank you, Mr. Gode. So we are moving on to item number, excuse me, give me 1 second to pull it back up. Item number 6, athletic service training agreement. This is a consideration of a request for the approval of the renewal of an agreement between the East Baton Rouge Parish School Board and Oxford Clinic Foundation in the amount of $60,000 to provide athletic training services. It was brought to us by Ms. Lynn Williamson and Mr. Ben Case. I'll take a motion at this moment. And I can't see everyone, so if you could put your motion in the chat box, that would be awesome and helpful if you would like to make a motion.
Motion Lannis.
Thank you, Mr. Lannis. And a second?
Bernard, second.
All right, and I have a second from Ms. Ware Jackson. Motion is first and seconded by Ms. Lannis, Mr. Lannis, and Ms. Evelyn Ware Jackson. Are there any comments or questions from the board? I'm seeing no comments from other board members. I'll just make a brief comment that I had an opportunity to visit the facility today. So thank you to the auction team for giving me an opportunity just to see the facility that is being used with the athletic service trainers and the things that they are able to do technology-wise as it relates to the medical profession. Great team, great staff, and just thank you for giving me additional insight as we consider these contracts going forward. Are there any additional questions or comments from the board? All right, I see none. We'll go to the public comments. Ms. Armand, if you don't mind, I don't have the public comments up at this time. Are there any public comments on this item?
Yes, sir.
All right, give me 1 second. All right, so for item number 6, we have a public comment from Ms. Deanna Melanson, East Baton Rouge Parish School Board. Thank you for doing what is best for your athletes and having licensed and certified athletic trainers on your campuses the last few years. With the athletics starting to pick up, it is now more crucial than ever to have committed, passionate local care for your student athletes. As the BROC Foundation launched last year, we saw gaps in the systems taking care of kids in our greater Baton Rouge area and have worked diligently to not only provide life balance to those that care for the student athletes, but also provide a level of care that is second to none. We have direct access to orthopedics in every corner of every parish 7 days a week. Physicians, sideline coverage from the same docs who stand on LSU, Southerns, and the same sidelines. And we are passionate about education for our coaches and parents. VROC and OL want to provide the best care for all the high schools, including the one already staffed with an athletic trainer. Our next comment comes from Randy Gonzalez. I have been a certified athletic trainer for over 30 years. The last 11 years at Welland High School, we have been fortunate to have a sports medicine academic program at our school. This program has provided an educational component to our athletes that are not received at other schools. The second aspect of our program is the care that I provide our students under the direction of our team physician. I'm not able to perform any duties of care and rehabilitation without his supervision. We have been fortunate to have a physician on our sidelines for our home football events. I would strongly urge the board to continue and expand athletic medical coverage to the point that we have certified training at each high school. The idea of having a certified athletic trainer in our middle school would also be advantageous. Coaches can coach, and I can provide, and I will provide medical care daily. Take a short trip to the Citizen Parish to take a look at their programs and duplicate them. That concludes our public comments for that agenda item. We will move back to the board. Are there any additional questions or comments from the board? I will also see no additional comments from the board. I also like to uplift that during that tour, they talked a lot about, a lot of people have been asking questions about the return to sports. And Oxner and the medical professionals from around the parish have released or getting ready to release some guidance as it relates to like what is safe return to sports and how people think and consider about sports. So I think everyone should be on the lookout for that guidance just so as you can consider and have that conversation as it relates to what's happening with athletics, as I know a lot of people are concerned with that. Seeing no additional comments or questions from the board, Madam Secretary.
We're trying to fix one problem. 1 second, Mr. Howard.
Thank you, Ms. Almer.
Please vote. Mr. Blue?
Yes.
Mr. Lannis?
Yay.
Mr. Howard?
Yes.
Ms. Collins?
Yay.
Ms. Ware Jackson?
Yes.
Ms. Dyson?
Yes.
Can you mark your button, Ms. Dyson?
Yes.
Ms. Bernard?
No.
The motion carries.
All right, the motion carries. We will now move over to item number 7, Memorandum of Understanding, and I will now turn the meeting back over to Mr. Gode. Thank you.
Thank you, Mr. Howard. I believe the next item was item number 9, the charter contracts. Consideration of a request for the approval of a contract between East Baton Rouge Parish School Board and the following. HCS Baton Rouge doing business as Helix Aviation. Yes.
Mr. Gode, are you skipping an item? According to, is it not item number 7 or did that get pulled?
Well, we passed that on the consent agenda.
Gotcha. I got you.
These are the ones that were pulled.
Gotcha. Thank you.
You got to keep it moving. It's confusing sometimes. So I'll start over. Item number 9, consideration of request for the approval of contract between East Baton Rouge Parish School Board and the following. A, HCS Baton Rouge doing business as Helix Aviation School Operators, and B, HCS Baton Rouge doing business as Mentorship Legal Academy Operators. Do I have a motion?
So moved.
Motion by Mr. Howard. Was that Mr. Howard I heard?
Yes, sir.
And a second by Mr. Ballou. Ms. Collins.
I was just about to text. I want to hold on to my request to speak until after public comment.
Thank you, ma'am.
Thank you.
Are there any other board members wishing to speak on item number 9? Seeing none, we will go to the public comment, which I am just refreshing, and I do not see any comments under the public comment. Ms. Armand, can you confirm that?
I'm checking now. Let's see. I see no comments.
Thank you. So we'll go back to the board. Ms. Collins, would you like to speak at this time?
Yes, okay. So there was chatter online, and then also one of my constituents had reached out to me about this. And they usually quick to insert some public comments, so I was going to let them explain their concerns. They sent the email. Our legal counsel had responded to the concerns addressed in the email, and because there was chatter online, and I know that charter school issues can be contentious, if our legal counsel could go ahead and address, it will be real brief, address the concerns that were lifted up about this contract.
All right, Ms. Collins, would you like me, there were about 5 questions presented. Do you want me to address each one of those?
3 through 5, I think, is the most pertinent, based on, because the constituent had called me directly, and from what I gathered from the conversation, 3 through 5 was the ones that were most pressing. Sure. The first question raised had to do with provision 5.1.1, which deals with the initial term of the charter. The assertion was that the provision was vague in some way. I restated the provision to Ms. Collins, who I believe forwarded it to the constituent. I indicated clearly the intent of the provision. It's my belief it's been drafted clearly, clear enough to be understood by any reader who wants to read it and delve into it. But basically, it sets the initial term of the school at 4 years, subject to a review after its 3rd year of operation and a potential 5th year. So its initial term could be a maximum of 5 years if the school is meeting all of the requirements of our policy. That was the first. On that particular one, I'm sorry. The constituent had an understanding that we were adding more time to what was previously agreed upon. Can you clarify that? Yeah, I'm not certain where the constituent got that interpretation, but our policy and this contract, as with all of our charter contracts, sets an initial term of 5 years, 4 years with a potential additional year, 5th year, should they meet all the requirements of operation after their 3rd year. So our staff reviews the operation of the school. If they're meeting the requirements that we've set in policy and operationally in other ways, they're granted a 5th year to operate. So the initial term of the school is 5 years per the contract and per our policy. And for clarity, contingent upon the results of a review conducted after the completion of the 3rd year of operation. That review to be conducted is based on existing charter, existing charter policy. That's correct. So that the nature of the review, etc., is not in question. That's correct. Okay. Okay. I believe the second question had to do with charter with well, I didn't really understand the second question, to be honest. It had to do with identical charter boards and other charter schools. I wasn't certain where the constituent was going with the question. My conclusion was that the assertion had nothing to do with the contracts that we're putting forward for approval. This board has been very intentional with asking me to make sure that we bring contracts back to the board for approval for all charter schools that you guys have authorized, and that's what we're doing. This is the 3rd contract brought back to you as required by policy, but also as requested by the board. So I believe it's my recommendation that it's in the best legal and business interest of the board to go ahead and approve these charters.
these charter contracts so that the relationship between the board and the charter operator is clear and is laid out. And so wasn't sure about the second concern. The third concern had to do with the absence of the charter management operational agreement, which is Appendix B, I believe, of the contract. We'd not received a copy of that as of the request. However, my response was that the CMO, the agreement with the CMO, has no impact on the terms of our contract with the charter operator. I began, when we drafted these new contracts, I began to request the potential of basically adding CMO agreements to the contract merely for reference. Should we ever need to know who what the details of the agreement is between the charter operator and the charter management organization, we would have it at our fingertips. It's not a requirement for the contract to move forward. I'm sure I'll get a copy of that in due time, but it should not stop the approval of this contract because, again, this is about the contractual relationship between you, the board, and the operator you authorized a year ago. And so I will forward to the board a copy of the CMO. I'll put a request out to council for the operator, and I'll get a copy of the CMO and forward that to the board for your inspection upon receipt.
Okay. Thank you. I just wanted to make sure that because again, charters and charter policy, et cetera, can be sensitive depending on you know, who's having the conversation. And since that was put out there, I just felt it was really important just to be clear that, to address those concerns.
Yes, ma'am.
Mr. Lannis, is this, I'm sorry, you're not up, my bad. I just have one comment on this as it relates to the 4 years and then the 5th year. Mr. Shamlin, if I remember correctly, that is the way it is stated in state law. And part of what we're doing is putting into contracts the details around this, because prior to these contracts and prior to having our guidelines, which Mr. Howard and Ms. Ware Jackson worked so hard on, the 5th year was just being routinely granted with really no review. So now we're really trying to put in a formal review with specific criteria and things that will govern that 3rd year review. So really we're adding on to what we had been doing, and all of this is following state law. So it's tighter than what it used to be, because quite honestly, there was no 3rd year review being done in the past.
Yes, state law. Yes, sir. State law and our policy, which basically codifies the state law for us locally.
Thank you. Are there any other comments from any other board members? Seeing none, Madam Secretary.
Please vote. Mr. Blue?
Yes.
Mr. Lannis?
Yay.
Mr. Howard?
Yes.
Ms. Collins?
Yay.
Ms. Ware Jackson?
Yes.
Ms. Dyson?
Yes.
Mr. Gode?
Yes.
Ms. Bernard?
Yes.
Working for Clay Ketchum.
The motion carries.
Thank you. Now we will move on to item 10. Consideration and request for the approval of the Student Rights and Responsibilities Handbook and Discipline Policy for the 2020-2021 school year for the East Baton Rouge Parish School System with noted changes. Do I have a motion? May I have a motion, please?
I'll move.
Mr. Ballou? May I have a second?
Second, Lannis.
Thank you, sir. So we have a motion and a second on item number 10. The board is now open for requests to speak.
You see me, Mike?
Ms. Collins, yes, go ahead.
Okay. This might be kind of difficult, but I hope we can find a simple way to address. And you may, colleagues on the board, you may not have seen the email that came at about 5:12 because it came in after the board meeting. Ms. Lamondre is a legal counsel at STAR, Sexual Trauma, and I forget the acronym, but STAR, I'm sorry. And so she gave a very detailed explanation of what appears to be some very valid concerns where we, our policy handbook for our students is extensive. And so she lifted up some very valid concerns because of the time that he came in. Of course, it couldn't be addressed before the meeting. And I'm hopeful that at least this particular piece dealing with child abuse and reporting of child abuse. I don't know if it would, if the board would be amenable to passing the handbook minus that piece so that that can be addressed, or maybe deferring the policy. I know we've gone through the committee as a whole, and this is the regular meeting, but this is this constituent's first time reaching out to us to address policy, and so I'm going to offer a substitute motion, if that's amenable to the board, to pass the policy with the correction, with the amendments already in place, minus the policy on reporting of child abuse. Because the concerns that were lifted up was that some of our updates don't reflect changes from the Louisiana Children's Code. And so that seems significant. And there are several others, but I'm just lifting up that just so my colleagues on the board can be aware why I'm trying to see if we can work on this. I don't want to delay the whole student handbook, but is there a way, or is there any other way that these issues can be addressed without overcomplicating tonight's vote, but not waiting until wait next year?
Yeah, I'd like to speak to that, Mr. Gode, if you're okay with that.
Yes, please.
All right, I have some concerns with, I am not calling into doubt the constituents' questions. Mm-hmm. I want to remind everyone that these revisions have been vetted by me, by external counsel, and by a number of other sources to match recent changes in student sexual harassment, which I believe is part of the issue here. Okay. We are required to enact, we've already enacted policy, but we are required to then enact protocols that match policy. The student handbook is part of that protocol, right? Mm-hmm. And so it's my recommendation that we enact it as drafted and then review it for potential amendments a month from now or 2 months from now for a number of reasons. Number one, we have to have in place student practices and protocols and rules because we have kids now back in school virtually. And one of the things that this manual does is it applies our discipline policies across the board to virtual school, virtual classrooms, and virtual learning environments. That's important to have in place something for students and parents to have an expectation. That's number one. And number two, I would need to vet and really read the recommendations by the constituent to make sure it aligns with the law, because there may be some confusion, or there may even be some conflict between what we're being told to adopt from a federal level basis versus what our state law has in place. That may be beyond what we can resolve in our student manual. We may be able to resolve that with some of our practices and with our investigatory procedures, et cetera, and our training to staff. So I want to be careful about not pushing the book ahead, because our administrators, our teachers, we really need this in place. We need to be able to disseminate this to parents Monday of next week. digitally so we can have in place a foundation for rules, for discipline, for expectations, et cetera. Does that make sense?
Okay, and it's nothing prohibits us from, meeting with the constituent, clarifying whether confusion and or what have you is, and if any amendments need to be made, that can be presented at the next meeting.
Certainly, I would be glad to meet with the constituent, talk it over, but I also have to vet that other sources to make sure that we're aligned with the law.
Yeah, and she is an attorney.
Yes.
But you have to do your due diligence, of course, as you said, and cover us. So, all right. So then I won't offer a substitute motion. I see a reasonable way to move forward without holding up everything.
Thank you.
Thank you, Ms. Collins. Is there anyone else who would desire to speak? Seeing none, I will now go to the public comments, and we have two. We have three. First is from Dina Babcock. This review committee is a farce at best. Several members have dual relationships with the district. A democratic, transparent, and representative committee needs to be established. Oversight committee should not just be rubber stamps. Next, we have a comment from Morgan Lamondre, who I think we were just discussing. Hi, I'm Morgan Lamondre, if I'm pronouncing that correctly, an attorney at the Sexual Trauma Awareness and Response and the mother of an EBR public school elementary students. I sense some concerns about outdating and confusing components of the policy related to child abuse and neglect to the board via email. In the email, I detailed many of the issues which I had, which are too many to list here. Please consider discussing the information I provided in an email on the record so the board can address those issues. Thank you. And for Mr. Kohanda Corley, this handbook has failed to address so many issues our students, parents, and staff are plagued with and forced to address. Our handbook does not address truancy while attending virtual. The handbook states regarding due process hearings that the student would have a hearing in the presence of the school board, which is not in line with IDEA. This practice would also violate the parents and child's right to a closed hearing and remaining confidential. This handbook also wants to conduct MDRs after the fact, which is not in line with IDEA. This handbook has sexual molestation considered as a minor offense, but oral sex is a major offense. Why are they not considered equally or in reverse, considering one is consensual? This handbook has more offenses and items not in line with the law for children with disabilities, as well as Indigenous, Black, and Brown children. I would strongly recommend and encourage EBR Public School System School Board to use your parent task force to aid you in creating a handbook. So that is all of the public comments that we have. Thank you. Ms. Ware-Jackson.
Thank you, Mr. Gode. That last comment reminded me that someone did send me a question that's related to that and wanted to know, and I don't know who this would be directed to, whether it's the superintendent or our attorney. How do we plan to address those that are not attending school at this time, or those that have been kicked out of class before it becomes an issue of truancy?
So thank you very much for that question. We actually have connected a virtual system for supporting students through their discipline as aligned to the school board policy on discipline. So during the virtual classroom setting, a teacher can write a referral if a student does something inappropriate, and it will go through the same process of going to the assistant principal, And they are really worked with to find out what the challenge was, and also following the discipline policy as far as what the discipline action would be for that child, based, of course, on what had happened in the classroom. So the process remains very similar to what is happening now. That has happened before. The only difference is that we actually have a virtual portal now that we're able to track the data to see where we may be having challenges in one area versus another area. And I mean, you know, behavior that we may need to work on and get some support out to a school for particular behaviors. So we've done, the team has done a really good job of designing a system that the teachers can have support for discipline, and the students also go through basically a process to make sure that they're being treated fairly with what the consequence is for the action.
Okay, thank you, ma'am.
Thank you.
I am seeing no further comments. If anyone would like to speak. Seeing none, Madam Secretary, would you please conduct a vote?
Mr. Goday, was Mr. Lannis the second on this item?
Yes, he was.
Okay, thank you. Please vote. Mr. Blue?
Yes.
Mr. Lannis?
Yay.
Mr. Howard?
Yes.
Ms. Collins?
Yay.
Ms. Ware Jackson?
Yes.
Ms. Dyson?
Yes.
Mr. Goday?
Yes.
Ms. Bernard? Ms. Bernard?
Forensic evidence left behind.
Yes.
The motion carries.
Thank you. And at this point, I just want to add a comment. A public comment came on a prior item from Dr. Carrie Widener. I apologize, Mr. Weiner, but the timestamp on that comment is 7:15 on my computer. I don't know exactly when you put it in, but it was received here at 7:15, which was after that item had been addressed. So I apologize for that, sir. Now we move on to item H1, Children's Charter Surrender. Consideration of a request to accept the surrender of a charter by the Children's Charter School Board. Do I have a motion?
So moved.
I'll move.
Well, Mr. Blue moved and Ms. Collins second. Are there any comments or discussion from the board? Seeing none, Mr. Shamlin or Mrs. Brown, would either of you like to make a quick comment?
Mrs. Brown.
Yeah. Okay, thank you. Thank you. I just wanted to share with the board that the team and this charter school, Children's Charter School, actually have worked really well together in coming to this conclusion. This is one of the first charter schools that opened in the city of Baton Rouge, and the enrollment was low, and our team continued to work with this charter school in supporting as well as going through a closure, the surrender process with them. I think the team in the portfolio office, as well as Andrea Okonski, did a wonderful job of supporting this school through this process and making sure that all the children actually had an opportunity to find a school that their family was comfortable with. So we did send some backup data just so that the board would know the really incredible process that we worked with the school to try and find the best solution for the school as well as for the children. So thank you.
Thank you, Mrs. Brown. We have no comments on this item from the public, so we will go back to the board. Is any comments from the board? Seeing none, Madam Secretary?
Please vote. Mr. Blue?
Yes.
Mr. Lannis?
Yay.
Mr. Howard?
Yes.
Ms. Collins?
Yay.
Ms. Ware Jackson?
Yes.
Ms. Dyson?
Yes.
Mr. Gode?
Yes.
Ms. Bernard?
Yes.
The motion carries.
Thank you. Next, we'll have the announcements of meetings. Mr. Lannis?
Yes, sir. Thank you, Mr. President Gode. 1 second. All right, announcement of meetings. Committee of the whole meeting to be held on September 3rd, 2020 at 5 p.m. location to be determined. Regular board meeting to be held on September 17th, 2020 at 5 p.m. location to be determined.
Thank you, Mr. Lannis. Ms. Ware Jackson?
Mr. Gode, if I might, I needed to just say that I got a message from Taylor Gass just telling us that the resolution that I had spoken about earlier is also, added to the board webpage, and it's right under the guiding principles. I mentioned that they should go and look at board docs, but they can find that resolution on our webpage right under the guiding principles.
Thank you very much for that information. Seeing
Ms.
no
Ware
other
Jackson,
business-
it is still up on, I'm sorry, Mr. Gode, it is still up on board docs as well.
Okay, great. Thank you.
Thank you. Seeing no other business, this meeting is now adjourned.